like to discuss the new packaging for the Osteo-Ti system. We have three colours: yellow, blue and green. Yellow denotes the 325 implant, blue the 375 and green are 4.5 diameter implants. This makes it very easy for your assistant to select and make sure they're giving you the right diameter implant. Now let's look a little bit more closely about the packaging. Okay, so we're ready to open up the packaging now. We open up the box like so, and from within there we can remove the blister, and we can peel open the blister to reveal the implant carrier and packaging like so. Drop this out, and the implant comes double wrapped. If you look in the end of the implant, we can see there's a white sticker there, and this is where the cover screw is housed. Okay, so the inner vial now has the implant securely retained. We can't drop it out. It's very well retained and safe. And we're going to need to use an adapter to place on the end, and this is used to remove the implant from the vial like so. Now it's quite secure, it can't be dispatched or lost easily, and it's ready to use on one of the insertion instruments. So this will work with either the universal driver, and it fits in like so, or conversely it can be used with our ratchet like so. Either way, it's very secure and it's very unlikely to become detached during use. Now once we've finished, this is our receptacle for the cover screw. At the bottom of the inner vial, as I said, is a white patch. If we lift off the white patch, within there is retained our cover screw. The implant adapter comes in one size. The features and use of the driver are that it fits all our implant packaging. It is used to remove the implant from the plastic vial in the packaging, and it is used to start and initiate the insertion of the implant at the osteotomy site. It is important that the adapter should only be used in the early stages of the insertion process, and once the implant has been inserted by, say, a third of its length, the adapter and carrier should be removed from the implant and the extender E2 used to complete the insertion procedure and ensure that the implant is fitted either level with the crest of your bone or slightly below by up to 1 millimeter. Do not try to insert the implant entirely into the bone using the adapter and carrier mechanism, as this will result in jamming of the instrumentation and possible loss of either the implant or bone from the osteotomy site. So importantly, do not, unless the bone is extremely soft, D3, D4 type bone, do not try to fully insert the implant using the adapter and the implant carrier mechanism. Seating should always be completed using the implant extender. Again, this instrument fits our implant driver and torque ratchet. These instruments should only be used in the early stages with the adapter, and then the adapter and carrier removed from the implant, and final seating only performed using the extender, which has no locking mechanism. I cannot overstress the importance of ensuring that you do not try to seat the implant fully using either the carrier or the adapter. The extender implant driver is made of titanium. Its features are that it fits all our implant sizes and dimensions. This limits the amount of equipment and drivers that you need at setup. It fits the implant driver and our torque ratchet. An important feature to bear in mind is that this driver does not have a locking mechanism. It does not lock into the top of the implant at the abutment implant interface. In order to start the procedure and insertion of your implant, it is necessary to use the adapter, to be covered in a separate presentation. The extender fits both our implant driver and our torque ratchet. The implant is available in a number of sizes and dimensions and has many useful features which will be covered in this presentation. The system combines the evidence-based, proven, beneficial features of a taper lock implant abutment interface, platform switching with the restorative advantages of an internal hex. What are the main features of this system? Well, it consists of a selection of popular diameters and lengths. There's platform switching over the entire range, which helps minimize crestal bone loss. A standard hex size throughout the entire range means that insertion tools and abutments can be common to all implant sizes and are standard. All components have friction fit and hermetic seal, eliminating micro leakage and preserving crestal bone. The surface is an SLL type, which has been proven to enhance integration. The geometry of the implant body is tapered, which improves primary fixation. And finally, the implant is self-tapping and drilling, which reduces the number of drilling stages and ultimately improves primary fixation. The system therefore combines all the recognized evidence-based advantages in one modern system. So the system has platform switching, and as I said, this is incorporated throughout the entire range, including even the smallest diameter at 3.25, and perhaps this makes it unique amongst implant systems in that it is probably the only small diameter implant to have platform switching. If we look at the difference between standard implant abutment interfaces and a platform switched implant interface, as can be seen on the left hand side, we can see that the abutment is actually narrower than the implant platform, and this results in the horizontal placement of the biological width, so preserving your crestal bone. It also incorporates a hermetic seal, which not only improves the fit of the abutment to the implant, reducing the amount of possible loosening during function, but the seal also eliminates effectively micro leakage, which has been implicated again in crestal bone loss. As previously stated, the components actually lock together, and this drastically reduces the amount of component loosening and abutment loosening of the implant restoration in function. The threads are taken up high on the entire range except for the 3.25 where the head is grip blasted. A high thread helps preserve bone at the crestal level. If we look at the implant design features which promote primary fixation important for osseointegration, they are as follows. A high thread preserves crestal bone. Surface treatments, the SLL surface with proven enhanced integration. A self-expanding taper along the thread or the body of the implant expands bone on insertion, again improving primary fixation. The implant is self-drilling and tapping, and these are features which again improve primary fixation and also reduce the number of preparatory steps required to prepare the osteotomy site. The thread is designed for speedy insert, meaning that the pitch is such that the implant can be inserted with the minimum number of rotations. This reduces again the amount of damage to the bone implant interface caused through the insertion and improves again primary stability. All these features are accepted for improving primary stability and are incorporated into all implants in the range as standard. This is an evidence-based system for reliable treatment outcomes. In this presentation, we will be looking at the multi-implant post system used in conjunction with Osteo-Ti implants. The abutment is screw retained and self-locking. What are the main features of the abutment? Well, the first thing to note is that one abutment fits all sizes of anchor lock implants, regardless of their dimensions, that's diameter or length. The abutments are platform switch, and this applies again to all diameters of implants, regardless of their diameter. There's a friction lock incorporated at the implant abutment interface, which means that the probability of abutment loosening during function is very much more reduced, and it also produces a hermetic seal, which in conjunction with the platform switching feature helps minimize crestal bone loss. These abutments should normally be tightened to only 40 Newton centimeters unless you are experiencing unusually high frequencies of abutment loosening. The abutment comes in 6 vertical angular corrections and 12 horizontal offset corrections. And the abutment has been designed to be able to be modified by the laboratory within limitations. The multi-implant post is available in 6 vertical angular corrections, starting from 0 all the way up to 25 degrees in 5-degree increments. This maximizes the choice and availability of abutments to your laboratory to be able to correct angled implants. Now let's look at the implant abutment interface in a little bit more detail. The first thing to note is just above the connection, the hex connection, is a very slight taper. This taper engages with the taper in the implant, and when the abutment has been tightened to 40 Newton centimeters, it will be virtually impossible to remove due to the cold welding that will occur at the taper. So it is very important that clinicians do not tighten the abutment until they are absolutely sure it is in the right place and they wish to proceed. There is a separate tool that is available to help remove the abutment, which we'll discuss in another presentation. The other important feature with this abutment is that unlike other abutments, it does not come with a 6-sided hex but a dodecadon which has 12 sides. This allows for almost infinite horizontal positioning of the abutment, but at the same time providing indexing and stability. Finally, this abutment has been designed to be used with our gold new high torque screw and should not be used with the older low profile screws. Usually in function, tightening this screw to 40 Newton centimeters will be sufficient to ensure the abutment does not come loose during function. However, if you're experiencing unusually high levels of abutment loosening because of the patient's occlusion, then it may be tightened to 60 Newton centimeters, as this is well within inside the fracture tolerance of the components and the screw. The first thing to be noticed about the Hight torque screw is its distinctive yellow or gold colouring. This has been done to aid identification, and it also matches with the colouring of the multi-driver, and this helps you and your assistant to easily identify which driver needs to be used in conjunction with the screw when fitting restorations and abutments. The screw is designed to work and function at high torques. Normally it shouldn't be necessary to tighten an implant abutment to above 40 Newton centimeters. However, the screw will withstand torques in excess of 150 Newton centimeters. So this is an extremely strong screw, and it's been designed to reduce the incidence of a screw fracture during function, and also to allow high torques to be used in situations where you have repeated loosening of an abutment. And remember, it can only be used with our multi-driver. The first thing to be noted about the multi-driver is its distinguishing gold colouring. This helps easy identification during surgical procedures. I will now just quickly go through the main features of the multi-driver. The first thing is that it fits all prosthetic screws in the system. There is no need to have multiple drivers. This driver will fit everything. It also fits all our implant cover screws. So again, when you're doing either prosthetic procedures or surgical procedures, it's easy to realise whether you've got the correct driver present because of the gold colour. So remember, when either of these procedures is being undertaken, you should always have the gold coloured multi-driver present in your kit. It's also advisable to perhaps have a spare multi-driver so that you can have an independent prosthetics kit and a placement kit. It also fits all our healing abutments or the transmucosal tissue expanders. It helps carry our transfer device, the Anchor-Lock quick transfer system. And another important feature of the driver is its friction lock. This means that cover screws and post screws are securely held on the end of the driver if it is inserted correctly. But importantly, you should not be exceeding 150 Newton centimeters, otherwise the screw will fracture, and most likely you will damage the implant and bone around the implant. It fits our implant driver and also our torque ratchet. These are our drivers and torque ratchets, and the implant driver is primarily used in the maxilla, and the torque ratchet will be used for inserting implants and for tightening up prosthetic screws to 40 Newton centimeters. So remember, the gold colour means that this is the high torque screw. There are other screws in the system, such as the low profile screws, and these are silver coloured and work with a different driver, and these screws cannot be tightened to 40 Newton centimeters. If you are restoring an existing case, then you are advised to upgrade the low profile screws to the new high torque screw. Thank you for your attention. The site former is a handheld instrument used to prepare D2 to D3, D4 type bone in primarily the maxilla. Now again, it's very important to acquaint yourself and become familiar with the depth markings on this instrument. The first line is 5 millimeters, and this line is important when you're considering doing transalveolar sinus lift techniques. We have a 7 to 8 millimeter line, which is used when you're placing our short 7.5 millimeter implant. We have the 10 to 12 band, starting at 10 for our 10 millimeter length implant up to 12, and then we jump to 15, which corresponds to the base of the last band and our longest implant. The 17 millimeter is used if you intend to submerge your implant by 2 millimeters, as is sometimes required when you're doing an immediate placement approach. The final band is at 20 millimeters. These markings and bands correspond to bands and markings on the burr range. Although it is called the laboratory hex tool, it is also meant for clinical use as well. This driver is designed to be compatible with the earlier type cover screws, fits our earlier type low profile prosthetic screw, and should not be used in excess of 20 newtons to 25 newton centimeters. It should only be tightened to finger pressure. It is not designed to be used with a torque wrench or any kind of driver. Primarily, this driver is to remove cover screws from our early series implants, and also to permit removal of the low profile screw to permit its replacement with one of our new high torque screws. It is not to be used for tightening components together. The healing abutment range is called the transmucosal tissue expanders. They have been specially designed to not only allow for soft tissue healing, but also to promote and encourage soft tissue growth, so that we can develop an aesthetic emergence profile and soft tissue profile around our implant restorations. The expanders come in 3 sizes, starting on the left hand side with the mini transmucosal expander, and you can see the related ordering code, and we have the midi and the maxi sizes. What are the features of the transmucosal tissue expanders? Well, again, like all components in the Osteo-Ti range, one component fits all implant sizes and diameters. Again, it's very important for the soft tissue elements or abutments to provide platform switching in order to maintain a stable crestal bone level. In common with all system abutments, they incorporate a friction lock at the implant abutment interface. They are available in 3 sizes, and as they are made of a medical grade PEEK, which is a form of plastic, they can be adjusted to allow for the fitting of a denture or restoration. This is not normally possible with conventional titanium abutments, which cannot be modified to allow for insertion of a denture. The expanders are used in conjunction with our multi-driver, which is used to help seat and position the expander by pushing it into the top of the implant.